I'm Julia Grapsa, Editor-in-Chief for JACC Case Reports, and it's a great pleasure to have Dr. George Dangas, who is Program Director for TCT 2022, and he works from Mount Sinai Hospital in New York. George, thank you very much for this interview. Every year, JACC Case Reports publishes the best clinical case from TCT. I think it's the third year that we're working together, and we receive hundreds of cases, and eventually we publish like an issue dedicated to TCT 2022 will be. And what is your take-home messages from clinical cases? How important they are for the interventional cardiologist?
My pleasure to be here, Julia, and you do a great job as editor-in-chief of this relatively new journal, but very important journal, because when we started with the challenging cases, that was many decades ago maybe, and people were just sending CDs or films and then just a paper with it, and we had to go and view them, and slowly this became a session, and then we came about and formalized it, and it's a submission now for several years. And then Sky followed as well, ACC, even European conference have now ways that clinical centers and fellows and junior faculty that may not have a tremendous infrastructure access for research, they can participate and present in the conference, and with a challenging case that they do, if they're experts, they do either hemodynamic or complication or any other rare or impressive intervention. And I think that is very important for themselves, for their centers, and for the meeting, because it enhances active participation. And I believe, and I was actually the main proponent for all those things to expand, is the not only having spectators in the meeting, but give a chance to as many people to participate and show something of their own. And I think a lot of centers, many centers, they were coming to me, and that's the idea came about. They say, you know, we'd like to do something, but what to do? We don't have that much research to present an abstract. And right now, we're pleased to say that the challenging case competition is very established in all the meetings, and of course, the forefront of TCT, and even more motivate now the presenters, we give them a chance to be invited to write the case as a paper for your journal and get a publication out of that, and also work even more to make their case educational. And I think this gives even further motivation and even further reward, if you want, for the good selection of cases and a good job in so many people. And I think they all appreciate it.
That's amazing, George, and I'm very appreciative of our connection, the way that we're working together. We see a lot of sessions about procedural complications. How do we learn from the complications, what may happen in the lab? How important are complications for our learning curve?
Well, that's extremely important, because everybody gets complications, and you sort of need to know how to get out of a complication. Well, those that we hear about and those who publish about, somehow they're a little bit biased in a good way. There are the complications that did well, because nobody publishes a complication did not really get resolved or did not so well. But therefore, we have a lot of tips and tricks of all these difficult or weird or rare complications that can occur, and how people did get out of it. And a lot of those are not part or cannot be really addressed by any form of a trial. Just because there's a weird conundrum of maybe 2 or 3 or 4 clinical, hemodynamic, angiographic confluence of bad situations that are not going to be possibly part of any trial. But they happen. And these practical tips and tricks, through whichever way the particular operators got out of there, can help people think about those tips and tricks in their own difficult times and get over it. So I think they're critical, and that's why they're very popular.
Yes, actually our procedural complication issue is the most popular of the year, together with TCT 2022.
Never gets old.
Yes, that's true. So thank you so much, and really grateful for this incredible TCT that we are attending these days. Thank you.
Thank you so much, and congratulations on your journal on the great work you're doing.